What if I told you that in 2009, 20,000 young girls in India were secretly enrolled in a medical experiment without their knowledge? What if I told you that 6 of them died? And what if I told you that the organizations responsible called it a gift? This is the story of India's most shocking medical betrayal. July 2009. Remote tribal villages in Andhra Pradesh and Gujarat. Girls as young as 10 years old line up at their schools, excited about a special health program. They're told they're getting a life-saving vaccine against cervical cancer, completely free, courtesy of the government. But here's what they weren't told. They weren't patients. They were test subjects. The HPV vaccine program wasn't a government health initiative. It was a phase 4 clinical trial, a massive experiment conducted by PATH, a US-based organization, in partnership with pharmaceutical giants Merck and GlaxoSmithKline. 30,000 vulnerable girls from India's most marginalized communities, tribal children, scheduled castes, Muslims, became unwitting participants in what authorities would later admit was an unethical clinical trial. The perfect victims, isolated in boarding schools, separated from their parents, unable to read the English consent forms that school wardens signed on their behalf. The results were devastating. Within months, girls began falling ill. Severe headaches, stomach pain, dizziness, exhaustion, early onset menstruation, heavy bleeding, extreme mood swings. Then came the deaths. 4 girls in Andhra Pradesh, 2 in Gujarat, 6 young lives lost. Kudamula Sarita was just 16 when she died in January 2010. Her family insisted the vaccine killed her. Officials claimed pesticide poisoning. The truth, we may never know, because no proper follow-up study was ever conducted. Here's the cruel irony. The entire tribal region where these trials took place didn't have a single gynecologist. No pap smear facilities, no cervical cancer treatment centers. They were promised protection from a disease they couldn't even be screened for. It took a fierce campaign by health activists and parliamentarians to expose the truth. Under pressure, the trials were suspended, but the damage was done. April 2010. A bombshell admission. The Ministry of Health and Family Welfare finally acknowledged what activists had been saying all along. This was never a health program. It was a clinical trial. PATH's own annual report gave them away. They openly stated they were exploring the most effective vaccination strategies for human papillomavirus in India, Peru, Uganda, and Vietnam. Not delivering healthcare, researching it. PATH received over $256 million in funding that year, with significant contributions from the very pharmaceutical companies whose vaccines they were testing. This wasn't about saving lives. It was about expanding markets. PATH received over $256 million in funding that year, with significant contributions from the very pharmaceutical companies whose vaccines they were testing. This wasn't about saving lives. It was about expanding markets. India wasn't alone. PATH was simultaneously conducting similar demonstration projects across the developing world, targeting vulnerable populations who couldn't meaningfully consent to participation. The 2013 Parliamentary Standing Committee investigation was devastating. Their report concluded that PATH had violated every ethical norm of medical research.